Hi, I'm Dr. Ron Allen. A common question is, what am I going to experience on the day of my LASIK procedure? Well, first you're just going to check in and go over the paperwork. If you have any questions, we'll go over those. Some patients, certainly not all, are going to need some retesting before you enter the procedure room. And then once you actually come in the procedure suite, we'll get you settled on the laser bed. We start with a laser that's going to create the LASIK flap by just making a very precise bubble layer. Usually the whole procedure takes about 10 minutes, and it's extremely rare anybody thinks anything hurts. You don't have much to do with it. A couple times we'll ask you to look in the direction of lights, and I'll be talking you through the whole thing. So again, in this first laser, one eye will be taped shut. We'll have a little eyelid holder separating your lids. We position a really soft ring gently, and then I'll tell you, here's the pressure. For about a minute you'll feel a pressure sensation. The vision usually dims, and your job is just trying to be still like a statue. You're just trying not to squeeze your lids, not to move, just sort of let things be. If you can do that for about a minute on each eye, it's literally 90% of the stress. And when that's done, it's blurry from the bubble layer. We'll just rotate that bed under the other laser, and the laser to get rid of your prescription is even easier to experience. We'll still have one eye covered. We'll have another little eyelid holder separating your lids. There's some gentle touching. And then the laser is just going to make a little bit of noise for a few seconds. When you're done and we sit you up, it's blurry because the corneas are swollen, but you can already usually see a clock. You can tell that your prescription's gone and everything worked. And then we want you to go home for about a 5-hour nap, because the eyes do get scratchy right afterwards. But when you get up from your nap, usually you're good enough to watch TV, check your phone. Usually the next day, the vast majority of people are fine for driving and working. It certainly takes about a few months to fully optimize your vision, but you're going to be functional right away. And so again, it's normal to be a little nervous anytime you have a procedure done to you, but this is going to be so easy, it's really going to surprise you. We'll take great care of you.